Okay, we are continuing our study of drug absorption and interaction with our body, or as a matter of fact with body of any animal. Please just list of routes of administration. We already look at IV administration. Uh, Here is the simplest absorption pattern. No absorption is required. Has immediate effects suitable for any kind of compounds and absolutely important in emergency situation. Anything that can mix with blood can be injected. On the other hand, it's a little bit risky and requires professional work. Most common way of administration is oral. Absorption factors are very complex. It's affected by many parameters. On the other hand, it's most convenient, very safe, very economical route of administration. Obvious disadvantage that it may not work. Absorption can be limited. Food and drink can affect this process. Your patient need to be compliant, which means, well, at least be conscious. And you may have metabolic problems. You may have different ways of injections, easier than IV, and they are suitable for different other drugs. You can look at it. You can use transdermal patch, which offers slow and sustained process. Uh, it's convenient, painless, ideal for drugs that are quickly eliminated from body because you continue adding. But of course, it's inconvenient to have a patch on you. Your drug must be lipophilic, so it should go through the screen, and it's slow, and dosages are very small. Rectal way is erratic, variable, but allows to bypass some effects, especially when the drug causes vomiting. Possible for patients who are in coma, and well, still a little bit tricky. That other way, rectal ingestion can be source of poisoning. Inhalation, well, that's very common. Say, for example, smoking, vaping. Absorption is very quick, ideal for gases. Effective if you have lung problems. You can change doses. Especially important when you target lungs. And there are few systematic side effects. Now, drug enters brain quickly. This can be negative. A patient cannot regulate dose, and some patients may have problems with that. Sublingual instead of oral, that's another way of drug admission. Just primitive scheme of subcutaneous injection, so under the surface of skin, and intramuscular injection. It's easy to see that intramuscular gives you smaller concentration than direct IV with the same amount injected. After several minutes, the concentration will be the same. So you do not have this peak that can be disadvantageous. The general kinetics of any of drug admission processes can be described by this primitive scheme. You have first rate reaction, drug sitting at administration site, comes into blood. Again, it's first order reaction proportional to concentration of this drug. Elimination of drug from blood will be another first order kinetic reaction. We will see about it later. And now you have two first order reactions. Drug is moving from blood into tissue, and drug from tissue is coming back in blood. If it's long-term process, two first order reactions will make one equilibrium constant here. For oral way of entry, there is very common parameter that we name bioavailability. What does it mean? You have concentration of your drug as a function of time. This is your curve for IV, and this is your curve for oral administration. So here you have it injected, and here you ate tablet or powder. Now we look at area under this curve. This curve, IV and oral. Area under oral curve divided by area under IV curve we name bioavailability. It cannot be larger than 1 or 100% by definition. So where these drugs can be absorbed if they are admitted orally? They can go in stomach, and stomach has very acidic pH from 1 to 3, has relatively large surface area, 5 square meters. Food stays, and food and drugs coming with food stays in stomach from 1/2 of hour all the way to 20 hours, depending on the amount of food. Next, whatever coming into stomach comes into small intestine. This area has pH slightly below neutral, 5 to 7, and it has a normal surface area of 200 square meters. Food and drugs spend around 2 hours in this area, after which they are coming to colon, which has mildly basic or even neutral pH, very close to pH of human blood, relatively smaller, still very large surface area, 5 square meters, and whatever contents can stay there from 2 hours all the way to 1 week, depending on conditions. So what we want to have reasonable bioavailability, so your drug is coming into bloodstream, it should come from stomach or intestine or colon into plasma. For that it needs to be dissolved. When you take your drug as a solid form, you need to bring it into aqueous solution. Rate of dissolving is proportional to diffusion coefficient of your drug in water. Larger molecules will do it slower. Proportional to surface area of your solid. Proportional to solubility of your solid. So first, drugs with very low solubility will have fantastically low rate of dissolving, and as a result will not dissolve at all during their stay in intestines. For example, if you have a poison that is completely insoluble in water, it will not be poison. An example can be barium sulfate, a contrast solid for X-ray. Barium salts are fantastically toxic, but solubility of barium sulfate is very low, so it just comes out from you without doing any damage. Next, we want to have a very large surface area if you want to deliver the drug, so it should be very fine powder, better not even crystalline but amorphous. So it makes a difference in which form you have your active pharmaceutical ingredient. Companies that know how to do their job, they are making a lot of effort to make tablets or capsules that will deliver the drug in appropriate rate. So again, we have two parameters: solubility that we cannot control, and surface area that we can control. And usually we want to make as large as it is possible, which means our powder should be as fine as it is possible. Another important parameter is partition coefficient between organic and aqueous phase. Our drug should go from aqueous phase, say in your stomach, into stomach walls that are organic compounds. So a good model of that would be, of course, water for aqueous solution and octanol, octyl alcohol, for organic phase. This partition coefficient can be easily measured using usual organic chemistry setup. So we have a ratio between concentration in octanol and concentration of water. Usually that's a big number, so we are taking decimal log of this number. If our compound doesn't go to octanol at all, usually it will not be coming from stomach to bloodstream. On the other hand, if it's too fatty, so it has very large log P, usually it will have very low solubility in water, and it will stay in tissue, so it will not come to bloodstream as well. You should have something intermediate. This intermediate was formulated by Lipinski, American pharmacist, around half a century ago, making very simple rules for orally active drug. So for compound to be suitable for oral digestion, it should have no more than 5 hydrogen bond donors, total number of nitrogen hydrogen and oxygen hydrogen bonds. No more than twice by 5, so 10 hydrogen bond acceptors. That's usually all nitrogen and oxygen atoms taken together, plus maybe sulfur atoms, if any. Molecular mass should be less than 500, and octanol water partition coefficient should be less than 5 in log scale, so coefficient itself less than 100,000. Example of good drug, omeprazole, formula weight 345, less than 500. We have 1, 2, 3, 4, 5, 6, 7 possible acceptors. We have one donor, less than 5, and octanol water partition coefficient is reasonably big but much less than 5. So it's a good example of orally available drug.